Hi, everybody. Welcome back to Hot Flashes and Cool Topics. Today, our guest is Lisa Caddy, and she is a trichologist. And you may ask, what is a trichologist? So welcome, Lisa. We're going to answer that question now.
Oh, thank you so much for inviting me. It's a really exciting thing to do. And yeah, spread the word of trichology. Yeah.
So what exactly is a trichologist?
So a trichologist is an expert or a specialist in all things to do with the hair and scalp. So as you would see a dermatologist for skin issues, actually trichology is a branch of dermatology. So we just specialize in this, the skin of the scalp and the hair alone.
Okay, that helps. And
it does.
What I wanted to start with is a question that I have, and then we'll get to our guests, our listeners' questions. But what is the difference between hair loss and hair thinning?
And that's such an important place to start, because that will open up the right and wrong questions and answers during the whole of our conversation. So I would call it, actually, first of all, the word alopecia just means hair loss. And that can be any type of hair loss. That can be hair loss when you've had a baby. That can be hair loss through an autoimmune condition. It could be genetic hair loss. So alopecia just means hair loss. It's this umbrella term. But that I do differentiate hair shedding and hair thinning. So if when you say what's hair loss, I would term that as hair shedding. And hair shedding is when you see physically too much hair coming out, when you shampoo or when you brush or when you handle your hair, an abnormal amount for you. So we do lose some hairs every day, that's normal, but an excessive amount is hair shedding. Hair thinning, I would largely describe as when a male or a female the hair starts to thin on the top area of the scalp predominantly. So the sides and the back generally remain the same, but we start to be able to see the scalp a bit more through the top area. Your parting gets wider. Sometimes when there's a light above you, you're looking in a mirror, you can start to see through that front area. So that's what I would call hair thinning as opposed to hair shedding.
Okay,
that's good to know
that was
the difference.
Interesting. I noticed when you brought up the pregnancy part, I can remember after I had my children having lots of hair loss. Then is that hormonal, or what are the causes of that?
Yes, definitely. So postpartum hair loss usually occurs a few months after you've delivered a baby, and it's all to do with the hormones. So long story short, really, you know, estrogen, the female hormone, hair loves it. It's a good hormone for hair. So most women realize that during pregnancy and as pregnancy progresses, their hair becomes fuller, more lustrous. It becomes amazing, because what estrogen does, estrogen is rising during pregnancy and it keeps hair in its growing phase for longer. So you don't shed many hairs during pregnancy. Unfortunately, once you've had the baby and those hormones decline, then all of those hairs which you really should have shed during pregnancy time get forced into a resting phase, and then they synchronize and they subsequently shed a few months later. So they go into a resting phase for about 3 months, and that's really when baby's born. When baby's about 3 months old, you see this dramatic or significant amount of hair fall.
Okay, that might lead to another question.
Right, I was going to say that kind of leads into the hormone change of menopause. So why do so many women who are in peri-menopause and menopause notice more hair loss? It's shedding and it's thinning, but some women suffer from one and some women suffer from the other.
Yes, absolutely. So again, it's mostly to do with estrogen. I mean, as women, we do have a combination. We do have both sex hormones. So we have estrogen and testosterone as well. So if we're talking about women seeing extra hair shedding when they're going through the menopause or when they are in the menopause, that's largely to do with this. You can have these kind of quite significant or sudden drops in estrogen. So hair follicles are very sensitive to hormones. And if you have these fluctuations of hormones, it can force too many hairs into a resting phase prematurely, and then they'll subsequently shed. So hormones, when they're kind of fluctuating, can trigger this excessive hair shedding. But hair thinning is the different thing. And what happens during the menopause, when your estrogen is in decline, you're losing some hair follicle protection from that estrogen. So when you're losing hair follicle protection from estrogen, your estrogen's dropping, but your testosterone then becomes a little bit more prevalent. It doesn't increase, but it's a bit more there. It's a bit more open to the hair follicle. So, and what testosterone can do in some people is shrink hair follicles down. So if you have a genetic predisposition for female pattern to inherit female pattern hair loss, as you get to the age where you're losing hair follicle protection from estrogen, testosterone is then more prevalent, and it's then triggered and can start to shrink hair follicles. So when hair follicles are shrinking, you're producing finer hairs, you're producing shorter hairs, and that's when over a period of time you can start to see that your scalp's more visible and that your parting gets wider.
Okay, that is really interesting. And so would a supplemental hormone help that? I am on both estrogen and testosterone.
No.
So would a hormonal
And
supplement help
HRT.
that? HRT? Or I didn't know if the damage was already done, if there was anything you could do about it.
Well, I think if by the time you're ready for HRT, you've already noticed some hair thinning, so those changes to the top area of the scalp, then you can't reverse that kind of hair loss, but there are treatments that can help to stop it in its tracks and halt it. So basically by introducing estrogen back into your body, it can give your hair a pick-me-up, but you're not replacing fully your estrogen back to where it was pre-menopause. You're just having enough estrogen to relieve those symptoms. So it can marginally help the hair. The difficulty sometimes with testosterone, if you have inherited that predisposition for hair thinning, your hair follicles don't like testosterone very much. They shrink in the presence of testosterone. And so supplementing with testosterone for women with genetic female pattern hair loss can actually nudge along the hair loss a bit more. It can exacerbate it. So it's all a bit of a balancing act between that HRT that makes you feel so much better, but also considering in the fact and what it might be from a negative point of view or a positive point of view be doing to your hair as well.
Okay.
Can you talk a little bit about female pattern hair loss and the genetics behind it?
Yes, for sure. So genetics plays such an important part with lots of things to do with hair and scalp and skin issues and all of those things. So as a woman, I actually have female pattern hair loss. My father was virtually completely bald by the age of 30, and I have inherited that gene. And a woman can inherit the gene from dad's side or from mum's side. It can go back beyond the parents and go to grandparents as well. And a male in the family also can inherit that gene from the male or female side. There used to be the thought process that the gene came from one side of the family.
Right. It was like if your mother's father was bald, then your son was going to be bald.
Exactly. But it's a bit like blue eyes, brown eyes. You inherit that gene from wherever. So you inherit this predisposition that says your hair follicles are going to be sensitive to testosterone in your body. So as a woman, I inherited that gene from my father, and it says my hair follicles don't like testosterone very much, and they start to shrink down in the presence of testosterone. And it can be triggered by pregnancy, it can be triggered by the menopause, it can be triggered anytime after puberty, actually. So what testosterone is doing is shrinking those hair follicles, and it's not, you don't really see high levels of testosterone in women. It's not about the level of testosterone in your body. It's about your individual sensitivity to normal levels of circulating testosterone. So I drew the short straw. Dad was bald. I've inherited the gene. In my mid-30s, I started to notice hair thinning, and I now use prescriptive treatment, which has put the brakes on, and I've been careful about my choice of HRT because some don't contain an obvious testosterone, some contain an ingredient which is a testosterone derivative, which can also further along that process of thinning. So that's the genetic side of it. You inherit the gene that says your follicles are sensitive to testosterone, and it is a progressive condition. So you do have to tackle female pattern hair loss when you notice it, because there's no reversing really to be done.
Okay, so you were saying you were taking something right now to help with that. Can you talk about that and anything that could help people going through this?
Yeah, sure. I mean, I work in our Mayfair clinic. We have a clinic in New York as well, and we have prescriptive hair loss treatments. And so the hair loss treatment that I prescribe to lots of my female patients and which I use is a combination of minoxidil, which is widely used to improve hair growth. And it's licensed, so it means it works, it's effective, and it's safe to use. So our combination has minoxidil. It also has a very low level amount of estradiol, because that's prolongs the growth phase of the hair cycle and protects the hair follicle. And there's an active anti-androgen in there as well. So an anti-androgen, I kind of talk about that as being an anti-testosterone. It doesn't lower your testosterone, but it protects your hair follicles from the effects of testosterone. So it literally puts the brakes on. There are different combinations. You'll find minoxidil alone is more readily available, and that's useful. It's a useful, proven treatment for female and male pattern hair loss. It does grow more hair, for sure.
So a certain percent of it can grow back if you use the right products. It's not like it's completely gone forever.
Yes, so you can get some improvement in growth and in density, but what you can't do is reverse the size of the hair follicles, which have shrunk down over time. So once they've got smaller, they're producing very fine hairs. We can't make those hair follicles back to their original size, but we can kickstart some growth in some empty follicles which are just dormant at the time. So that's where you see the improvement in hair density.
That's fascinating.
Really, that is fascinating. I always wondered about all of that. When you see the signs up for helping baldness, I'm like, how did that, how does that really work? Yeah.
Can you talk a little bit about, there's some myths for hair loss, don't shampoo your hair every day or use certain products. Can you talk a little bit about that?
Yeah, sure. I love talking about shampoo frequency because it normally surprises everyone. But as a trichologist, my interest is in having a healthy scalp, and your scalp is the bedrock of hair growth. So your scalp's got to be clean, it's got to be healthy, which means you've got to shampoo it frequently. So I talk about shampooing as you're actually cleaning your scalp, not necessarily your hair. Your hair gets cleaned by default. So you clean away, when you shampoo, you clean away dead skin cells, oil, sweat, bacteria, which is naturally multiplying on the scalp. And if you leave those things on the scalp for a long period of time, and I'm talking just more than 3 days, you can start to have inflammation inside the hair follicle. That can cause inflammation. So if you've got inflammation inside the hair follicle, that can actually lead to hair loss in some people. So from all angles, it's better to shampoo frequently. And I know there are definitely lots of myths about, well, shampooing will make your hair fall out, or shampooing will strip the natural oils and shampooing's not good, and that your hair will self-clean. And my answer to that would be, well, your face doesn't self-clean, so we
good response.
That is very interesting, because like you said, I can remember looking at different alternatives at one time, and one of them was like encouraging you to like shampoo once a month. And yeah, I can remember that. And I thought, I just can't do that. And another one, and I remember I tried it for a while, was to use vinegar and baking soda. And I can't remember which one was the cleanser and which one was the conditioner, but apple cider vinegar, I think that was the shampooing part. And then conditioning with baking soda with water. And it actually did fine. It didn't do anything. Colleen's face right now.
The idea of putting
it was, and it would, I don't think it did anything great for my hair.
Mm-hmm.
It didn't fall out, but it didn't do anything great. So
you're lucky it didn't. Is that myth accurate?
There is a trend actually for apple cider vinegar, and I'm not quite sure what the trend is. I think, the old wives' tale used to be about using a vinegar rinse on your hair, and that was because it's very acidic, and if your hair pH is more acidic, it closes the hair cuticle down, so you get better shine. But you don't need vinegar to do it, because conditioners are amazing these days. So maybe in the days when we didn't have great shampoos and conditioners, it might have been an option, but you definitely don't need to do that right now.
Yeah.
What ingredients should you avoid in a shampoo or conditioner if your hair is starting to show loss?
Well, that's a really interesting one, because there are lots of hair loss shampoos on the market. And I think my personal feeling is people are quite vulnerable when they're losing hair, and will buy into the fact that hair loss shampoos will restore their hair or grow hair. Hair growth is systemic, which means really topically, particularly in sense of a shampoo, they're on and off your scalp so quickly. There's no shampoo that's going to promote hair growth. So I wouldn't waste money on shampoos which say this is going to grow more hair. However, if your hair's feeling thin, if it's lost a lot of volume, you are going to want to choose a shampoo which is more volumizing. And that's the only thing that you can look for, a volumizing shampoo that gives your hair more fullness. And in terms of avoiding ingredients, there is lots of chat about parabens and sulfates and silicones. And I just think, it's not good to look at ingredients in isolation a lot of the time. You have to look at the whole formula of a shampoo. So if your hair, and I think I know where the whole sulfate thing is going, especially if you have curly hair, especially if you have dry hair, there's the thought that sulfates are more drying for the hair, so maybe you would want to avoid them. Well, not all sulfates are drying for the hair, and if it's in a combination of a formula of a shampoo that's packed with moisturizing ingredients, that's packed with conditioners, that will negate any negative or drying effects of a really good cleansing agent that's in that shampoo. So it's about buying a premium brand, pay a bit more for your shampoo and conditioner, and it will pay off, because generally the formulas are better, you get higher grade ingredients overall, and you can make a big difference to the quality and condition of your hair just by choosing the right shampoo and conditioner.
That's good to know.
Yeah. Are there any tricks to finding the right kind of shampoo or conditioner for your hair? I know that you kind of feel your texture of your hair and all that, but I'm always like, am I doing the right thing?
Yeah, sure. And it's a minefield because there are hundreds and thousands of shampoos and conditioners to choose from. I would say, and the way that our range at Philip Kingsley works, is we have labeled and we formulate our shampoos and conditioners based on your hair texture. So that means, is your hair fine textured, medium textured, is it coarse textured, or is it naturally coiled curls? If you can identify which one of those you are, then choose your shampoo and conditioner based on your hair texture rather than your hair problem. If you buy a shampoo and conditioner that says this is for dry hair, you can almost guarantee it's going to be very moisturizing. And if you've got fine textured hair, that's not going to work for you. So choose a shampoo conditioner for how you feel your hair texture is. And you can always use hair masks and hair treatments if you feel that your hair is out of condition.
Okay, that's cool.
I wanted to talk about the different products that Philip Kingsley has, but I have one more question in that realm of, what does stress do? Does stress cause hair loss or hair shedding?
I personally feel it does. It might be anecdotal, but lots of trichologists will say that they see it because, your hair cells divide very quickly. They're very demanding cells. And yet your body recognizes your hair as it's kind of classed as a non-essential tissue, which means your body couldn't really care less if you have any hair or not. But ironically, it needs a lot of taking care of in the sense of your general well-being, your health, and also your diet. So your hair's a very good barometer of your general health, I think. And I always imagine that in stressful circumstances, your body will kind of go into survival mode and really only take care of the functions of your body that are really important. And it knows that hair is not on that list. Hair is the back of the queue when it comes to being important. So hair's taken a lot of energy from food, from your general health, kind of lets go of hair for a while and will shut down hair cell production because it's trying to take care of you and your vital organs. So hair is that really good barometer of your health. If you're noticing hair shedding, you can almost guarantee there's something going on inside or systemically that's triggered that kind of hair loss. Yeah.
That is really interesting. I have a question, just something I noticed as I started to go through menopause. My hair started getting curly. And it might have been curly when I was very young, but when I was growing up, it was pretty straight. And then all of a sudden, it's not like kinky curly, but it's got these big waves going. Is that common? I have no idea. I'm assuming it has something to do with menopause.
It may well have something to do with it. And I think I've noticed the same thing with my hair as well. There is the thought process that going through the aging process, and that can mean you're declining estrogen levels as well. We know that facial skin changes. We know that facial skin loses elasticity and it gets slack. Well, the same thing happens to the scalp as well. And we've got hair growing and hair follicles which are embedded in the scalp tissue. So if we're losing elasticity in the skin, where the hair follicle is, that's changing the position of the hair follicle. So if those hair follicles used to be upright and straight and you're growing straight hair, you can get that movement in the change of the skin and the hair follicle. And so you can have some twists and turns and waves in the hair follicle as well, which will determine the shape of the hair when it grows through.
Okay. I always wondered, but yeah.
Along that line of questioning with menopause, why is it you start to lose hair in some places and you gain hair in other places, like your chin or places you're like, I never had hair there before?
Absolutely.
Why?
Well, we have to remember that all hair growth is hormone driven, all hair growth. And so what's happening with that change in hormones during the menopause, we're losing follicle protection of estrogen. So we're losing scalp hair, and we've got that more predominant testosterone in the body. Hormones are driving hair growth, and testosterone can drive hair growth as well. So it's that kind of imbalance all of a sudden, that we lose scalp hair, but that testosterone that's driving growth is driving growth elsewhere. You see it in men as well, aging men. You see them get very bushy eyebrows, hair's coming out of their ears, hair's coming out of their nose. And that's just that shift in hormones. It drives hair growth in one place and diminishes hair growth in another.
Okay. Yeah, that was a good question, Colleen.
Well, because so many women ask about that. Why all of a sudden is
this, like one real thin, like little thin hair will grow out of the blue, out of my neck, not up, but I'll be like, I think I have like a piece of hair from my head, and I'm like,
you're like,
wait
ow.
a minute, that's still there. And it's like out of the blue this long. I guess that's hormonal. I mean, I don't.
Yes, that's pretty much your testosterone kicking in.
Yes. Oh, it's so bizarre. It's like once every 5 years that'll happen. And I'm like, what in the world? I'm sitting here to the listeners.
Now you're checking. You're checking.
Yeah, like, is there another one going on?
What about hair coloring? Can that affect your hair loss or your hair thinning? Well, I guess not really hair thinning, but hair shedding.
It might be music to your ears, but you can go ahead and color your hair, even if you have hair loss. Yes, coloring your hair makes you feel better. Yeah, and when you're going through the menopause, especially, you have enough to deal with without thinking, oh my gosh, I've got to let my hair go grey as well. That's just kind of the final straw. Well, you don't need to. So coloring your hair doesn't cause what I call true hair loss, hair coming out from the root area. Okay. Yes, it can make the hair dry. If you overlap colour too much, you're colouring really frequently, you're having bleach highlights and the bleach is left on a long time. Yes, you can dry the hair out. It can get dull, it can get damaged, and it can break off. And in one respect, that is still called hair loss, but not in the sense that it's going to make your hair thin or it's going to make your hair shed. So I think actually colouring your hair is a really important thing for a confidence boost perspective, to make you feel better and happier about your hair. Just take care of it. If your hair is thinning and it has got fine hair is more fragile, so it doesn't tolerate chemical quite so well. You just have to treat your hair with respect, like a cashmere sweater. So you wouldn't overbrush a cashmere sweater or do anything too much to it. Treat it really gently.
And that was one of the questions too, about brushing your hair.
Right.
Yes.
Some of the women that listen to us say that when they brush their hair, their scalp burns.
Yes. And that is quite unusual. I have heard it before. And there is, you can have inflammation deep inside the hair follicle. And remembering, you have about 120,000 hair follicles on the scalp alone. And every single one of them has a muscle attached to it. It's called an erector pili muscle. So it's actually, every hair follicle is its own little organ, and you can get inflammation inside that hair follicle, and if it's inflamed, it can mean that muscle changes position, and it can feel uncomfortable when you brush your hair. Sometimes the wind just has to blow your hair and you can feel sensitivity. Your hair follicles are so sensitive. So it may be that there is a scalp condition underlying, and that there is some inflammation in the hair follicle, which really should be tackled. Either see a trichologist or see a dermatologist and see if there is any visible inflammation on the scalp that's occurring.
What about, why does our hair turn gray? Why, as we get older, do we lose the color in our hair?
I love all these great questions.
I'm sorry. It's just, as you talk, I'm asking you, should we color it? But why do we need to color it?
So we have the little cells inside the hair follicle called melanocytes, and melanocytes produce melanin, which is the pigmentation for your hair. And I always kind of think of them as an ink well, an ink reserve. So basically, when the ink runs out, it runs out. So hair isn't grey, hair is actually colourless. So it's basically that your hair follicle has, all those melanocytes have actually stopped producing pigmentation. So the colour pigment has run out, and then we get colourless hairs. There is a thought that being low in some B vitamins can actually exacerbate greying hair. And so some people like to take a B12 or a B9 just to see if they can kind of slow that greying process down. But predominantly the age of onset of going grey is largely genetic. So you've only got to look at mum or dad and think about when they
that's going to happen. Yeah.
That's so interesting. I wanted to talk a little bit about the products, the company that you work for. Can you tell us a little bit about Philip Kingsley?
Yeah, sure. So, as a Tricological brand, all of our products are formulated with scalp health in mind and with hair health in mind. So Trichology is a very holistic approach to hair health. So yes, it's important, the cosmetic products that you use, but actually, we look at your diet and lifestyle and nutrition. So we have a supplements range, which is a multivitamin and mineral, which can really help to boost your nutritional levels. But all the formulations of everything that we create has been looked at by a trichologist, because we want them to be the products which improve the quality and condition of your hair. So we don't just use ingredients which make your hair look shiny and feel silky. We are actually working on improving the integrity, the quality, the strength, and the condition of the hair as well. So all of our products have to be tried and tested by so many of our trichologists. And if they don't get the green light, then we go back to reformulating. But it's all about, yes, making you feel better about your hair, but improving the hair condition and quality as well. And that's why we use the highest grade ingredients. That's why as trichologists, we look at them very closely. And we just want to use those ingredients that we can say, yes, tick that box. That is going to help improve the condition or the shine or the strength of the hair over time. So they're very carefully curated, and we don't launch products really, really quickly. We want them to go through that testing process, and you'll see results from the very first time you use it. Even using a good shampoo and conditioner the very first time, if you've chosen the right one for your hair type, you will see that change in your hair, and you'll see those cumulative results in your hair as well. If you're good at routine, if you can build a few products of a regime into your lifestyle, that's when you'll see the biggest change with your hair.
So the product line that you have, does it divide people kind of into age ranges, hair color ranges? How do you figure out what product to give which patient?
Yeah, sure. So anybody of any age will benefit from our products, and all of them are formulated for color treated hair. So it doesn't matter if you have colored hair or not, you can use them. Doesn't matter if you're a man or a woman, you can use them. They're basically based on your hair texture. So if you say, yes, I've got fine hair, that's definitely me, fine strands, need shampooing really frequently, struggle to get some body and life into it, then you'll be looking at our bodybuilding volumizing shampoo range. But then we do have targeted products. So if you've got a flaky and itchy scalp, if that's your problem, then we've got real problem solving products. So our flaky itchy scalp shampoo, scalp toner, and scalp mask are all targeted for any kind of scalp flaking. You can use it on eczema scalps, you can use it if you have psoriasis, and you can use it if you have what I call just normal dandruff. So we've got problem solving ranges, we've got volumizing ranges, we've got treatment products. There's something out there for everyone. And I don't differentiate between male and female hair. So everyone, both sexes, all ages can use the range.
With one other question, we have several listeners that have gone through either breast cancer or a different type of cancer where they've lost their hair. Mm-hmm. When their hair starts growing back and they notice that it might be a little different texture or something like that, do you have any suggestions for them as far as hair care as it grows back?
Yeah, sure. And that's actually really quite common for the hair to grow back a different shape almost. So when you used to have straight hair, it can grow back more curly. And that's because the hair follicle's been distorted, usually through the chemotherapy. On most occasions, the hair does return back to normal at some point, usually a good 12 months after the chemotherapy is finished. So hair can return to the way it was. Often hair comes back better than it used to be before chemotherapy. But in terms of what you should do, lots of people do ask, what can I do to speed up my hair growth, and what's the best thing to do? Hair will return anyway. I would say just be patient, give your hair the chance, and it will regrow. It can come back baby fine sometimes. but it's about treating your scalp really gently. So your scalp can become incredibly sensitive or sore or itchy. Just use products which are very mild, not highly fragranced. Try not to spray anything onto your scalp. But if you want to look after the condition of your hair, if you want to improve the condition of your hair that's growing through, we have an amazing hair mask hair treatment called Elasticizer, which is fragrance free, and it's incredible for restoring the condition, the strength, the shine. So if your hair's coming through and it's feeling more dry than it ever used to, it's a really nice way to just improve the silkiness and the condition of it. And we also have a shampoo and conditioner that's called No Scent, No Colour. So it's free from all of those things that sometimes people don't want, especially if they've been through cancer treatment. So it's free from parabens and sulfates and fragrance and colouring agents. Very mild and gentle and beautiful on the scalp and beautiful on the hair as well. So you can just choose some really nice products which are going to be kind to you and just give your hair that natural chance to regrow anyway.
And you mentioned the sprays. So dry shampoo has been a really big thing. What are your thoughts on dry shampoo?
Well, you know, I'm an advocate of frequent shampooing, but I do understand the realities of people who haven't got hair like me. I've got fine short hair. It's quick and easy for me to shampoo every day. It's not for people who've got really thick hair or really curly hair. And so sometimes dry shampoos are a necessity. If the alarm doesn't go off in the morning and you have to get to work, you're going to have to use some dry shampoo. So we actually created our own dry shampoo and we formulated it to target the problems that people normally get with them. So people tell us that when they use dry shampoos, yes, it makes their hair look a bit fresher and look a bit cleaner, but they make their scalp itch. So our dry shampoo is called One More Day. Absorbs the oil on your scalp, makes it look nice and clean and fresh, but we've actually incorporated some scalp health ingredients in there as well. So some zinc and some allantoin in there, which calm your scalp and keep it feeling nice until you can shampoo the next time.
Yeah.
That's wonderful. And all these, you do have an office in New York, but all of these products are online, right? So if someone wanted to take a look, they would just go to philipkingsley.com, correct?
.com, yes, absolutely. And you can see our whole product range online. It's all there. Yeah.
Oh, have you pivoted at all towards telemedicine, having appointments online, or are you still doing one-on-one for people who want?
Well, we did close our clinic in the middle of March. So we've been doing video consultations since March, and that's been going really great. When you're forced into doing something you didn't think was possible, it's been really manageable and it's been so useful. And especially we've been able to reach people who would never have been able to travel to our clinic anyway. So that's been really, really useful. And I think this has been a time at the moment when people have had time to focus on themselves and say, right, I'm going to make that appointment that I've been meaning to make for such a long time and to get around to do it. So so much has been possible by doing this kind of consultation. If you can see people face to face, that's really all you need. And to be able to ask them those questions, it's really quite good.
Well, I'm definitely going to be getting some of the products.
Yeah, I'm going to have to be checking.
Right, exactly, because hair shedding, I mean, I look down at the shower and I'm like, that was on my head. I mean, literally.
I will say with HRTs, I do not notice as much of the hair shedding that I'm having. Since, I am on estrogen, but a tiny bit of the testosterone, not much, but I did notice that. So I don't know if that's helpful or if that's just with me, what's going on. So
I think, to resettle your hormones is definitely always a good thing for your hair. So it sounds like it's done the trick for you.
Yeah.
So post-menopausal, you should settle down a little bit if you're shedding a lot of hair.
Generally, it should do, but there can be lots of triggers for hair shedding. So, not just the hormonal shifts, but having low iron levels. Now that's less common once we pass the menopause because you're not having a monthly period. So your iron levels tend to retain quite well. But obviously, we've talked about stress. If you have an intensely stressful period, that can cause hair shedding. You can also have hair shedding if your thyroid becomes unstable. We develop an autoimmune condition, and we tend to develop more of these things in later life as well. Certainly thyroid problems are much more common beyond the menopausal age. So I think it's good to be aware of it, and if hair shedding goes on for longer than around 12 weeks, I would definitely have some tests done and look into that.
So you would suggest blood work and maybe thyroid checking in that?
For sure, yes. And you know, the things I would normally check from a nutritional status would be your iron levels, your vitamin B12, vitamin D, zinc, and red cell folates. They would probably be my top 5 blood tests to check they're all in order, to check those levels are optimized so that you have the best chance of growing the best hair that you can.
Thank you so much, Lisa. You know, we always learn something when we talk to our guests, but I have to say, I think I learned something every sentence you said this entire interview. Like, I forget taking notes. This was just too, you know, I'm going to have to listen to it.
You'll have to listen to it again. Because I was like writing, you know, all over.
You just can't. But this has been wonderful. And for you to take the time out to talk to us, we really appreciate it. Our really listeners are going to love this episode, I'm sure.
I hope so. You're so welcome. Thank you so much for inviting me. It's been a pleasure.
Thanks.
Stay safe and have a great day.
Okay, you too.
Okay.